Hi, my name is Elisa. We are going through the female reproductive system, and we are going to start part 10, puberty and menopause. So we'd like you to do a few things after all of this. We'd like you to be able to name the hormones that are going to regulate the female reproductive function, as well as their specific roles. Describe what the principal signs of puberty are. Describe some of the hormonal changes in the female climacteric and their side effects. We'd like you to know and be able to define what menopause is, as well as define menopause from climacteric, which is like a little bit of a sticky wicket. So know the difference between those two. Puberty begins now between the ages of 8 to 10 in the US for most girls. Previously and in the past, it began, sometimes around the ages of 16 to 18. So they may think, so folks are saying there may be an environmental effect that's causing it to occur in such very young children. We know that it is triggered by raising levels of trophic hormone, which stimulates the anterior pituitary to secrete follicle stimulating hormone and luteinizing hormone. Follicle stimulating hormone, or FSH, stimulates the ovarian follicles, and they will begin to secrete estrogen, progesterone, inhibin, a lot of other stuff. Or, well, not a lot of stuff, but like higher amounts of these items, and a little bit of androgen as well. A bit, not a much. Androgens are what we refer to as the feminizing hormones, and they have widespread effects on almost every cell type in the entire body. And the most abundant is estradiol, estriol, and estrone. During puberty, so let's talk about the process. So Thalarc, the onset of breast development is going to be the most outwardly noticeable sign of puberty. It means that estrogen, progesterone, and prolactin are going to be triggering the development of these ducts and lobules. Adipose tissue is going to continue to enlarge the breast as fibrous tissue is going to gain to keep it stable. The completion of the duct and the lobules are governed by the glucocorticoids and the growth hormones. Pubarc, or pubarche, appearance of the pubic hair and the axillary or armpit hair, sebaceous glands, right? Oily, like the stinky glands, some people say, if they have a smell to them. Then, of course, the axillary glands in the armpits. Androgens from the ovaries and the adrenal cortex are going to stimulate pubarc and libido to emerge. Menarche is, or menarche, is the first menstrual period. It requires at least 17% body fat in the teenager. If you have improved nutrition, sometimes the onset can be lowered to around an average age of 12. That is definitely lower than it was, like by like maybe as much as a handful of years, not even 100 years ago. So again, that's where they're starting to talk a little bit about environmental components that are impacting puberty in humans. Leptin stimulates gonadotrophin secretion. If the body fat and the leptin levels drop too low, gonadotrophin secretion is going to decline, and the menstrual cycle actually might kind of go away for a while. Like in athletes, for sure, that's definitely one of the ones. Menstruation ceases when the body fat drops below 22% in an adult female. The first menstrual cycles are anovular, meaning there's no egg ovulated generally. Um, the girls begin ovulating regularly about a year after they first start menstruating. Maybe not entirely always the case. So just that is just not something I would definitely take. Yeah. Because there are individuals who've become pregnant prior even to menstruation. So it just really take that with a grain. Estradiol stimulates many changes in puberty. It stimulates vaginal metaplasia, growth of the ovaries and the secondary sex organs. It stimulates the growth hormone secretion, increase in height, and the broadening of the pelvis. It stimulates the fat deposition and acquisition in the breast and hips and all throughout the body. It allows for the thickening of the skin. Younger children's skin is thinner, it's softer, and it has warmer to the touch than boys for the most part. Yes, I've never heard of that before. in a medical context, but maybe that's anecdotal. Progesterone primarily acts on the uterus as preparing for possible pregnancy in the second half of the menstrual cycle. Estrogens and progesterone do suppress, however, follicle stimulating hormone and luteinizing hormone secretion for sure through negative feedback. We definitely know that. Inhibin selectively suppresses follicle stimulating hormone secretion. And hormone secretion is distinctly cyclic, and the hormones are secreted in an order. All right, so next we'll be talking about menopause. I hope that was helpful getting you oriented. There's still a lot to kind of flesh out when it comes to puberty, especially in females, and why the onset is so early, and some of the ideas of why it's kind of like just becoming different from the way we had observed it, say, even 100 years ago. Okay, so I hope that is helpful. I hope you're out there somewhere having a good day. Bye bye.